All right, hi everyone. Today we're going to be presenting on Northeast Valley Health Corporation. My name is Graciela Denise.
And I'm Leticia Vivian.
Hi, I'm Nana Bazayan.
And the mission of Northeast Valley Corporation is to provide quality, safety, healthcare for residents, underprivileged residents of the Los Angeles County that reside within Santa Clarita or the San Fernando Valley. The history from the Northeast Valley Corporation, it was established in 1971. Its first clinic opened in 1973, and it was celebrated with the dedication of late Senator Kennedy, Ted Kennedy. Today, Northeast Valley Corporation has 14 health centers in the San Fernando Valley and Santa Clarita Valley. It has 13 WIC facilities, and it provides dental assistance, medical care, as well as behavioral care for more than 70,000 patients. The accreditation, Northeast Valley Corporation is a nonprofit joint commission, and it is funded through HSCI. The population that it serves underprivileged members of the San Fernando and Santa Clarita Valley, regardless of their ethnicity. However, the majority of their clients are of Hispanic descent. The tool that you see on the screen now is the tool that we use to guide ourselves to make sure the facility was culturally competent. Throughout my observation, I was highly impressed with the facility. They provided services starting with family medicine, OBGYN, family planning, lab services, nutritional education, education on disease and control, as well as behavioral health, and they had an extensive hours of pharmacy services. One of the requirements of Northeast Valley Corporation is that the members must be bilingual, since their population that they service is the majority of Hispanic or Latino descent. They must be bilingual in Spanish and English. Throughout the facility, I witnessed several forms in both languages, whether it be side to side or with the verbiage on the bottom, as well as visuals were provided for the patients. They used a tool to measure health literacy, which was composed of one question, and that's the yellow form on your lower right-hand screen. Again, the forms provided at the facility were English and Spanish. No other forms were visible at the facility. However, they did have interpreting services via a three-way phone conference phone. I think Graciela Denise, who was part of the interviewee, as well as Aralquio, aka Rocky Herrera, who is a registered nurse at the Santa Clarita location. Each of the interviews lasted approximately 30 minutes.
Sorry, I just had to unmute myself. So now the interview tool that we used was also guided by the cultural assessment framework. So a lot of those questions that we created, they embodied each of the 5 sections of the framework. So that's how we determined whether this organization was culturally competent. So those are the questions that were asked during the interviews. Now, as far as the highlights, again, we separated the questions into different sections. So the questions that talked about cultural, ethnic group, specific demographic characteristics were geared to identifying the demographics served. Like mentioned before, a good portion of those patients are Hispanic and Latinos. Various groups from the Hispanic Latino population come from different Latin American countries. There are small groups of African American, Middle Eastern, Asian, and Caucasian patients in the organization. Language determination tools are also used to determine the patient's language. So when patients first go into the clinic, they can use that tool to let the organization know which language they speak, and if interpreting services are required and needed, they can have the exact language that needs to be spoken. And again, it's used through a phone. It's the language translation hotline, which is available for all patients that require interpreting services. We did ask what kind of morbidities they see in those specific cultures or communities. So mostly for the adult patients, a lot of the diseases that they saw is hypertension, diabetes, high cholesterol. And a lot of these are related to the Hispanic Latino population because there is a high fat and carbohydrate intakes in their daily nutrition. With children, there was a lot of obesity and asthma that were commonly addressed, and it can also be related to nutrition factors. When we look at other communities, for example, the African American community, we also saw correlations with blood pressure, also prominent in the Hispanic Latino communities. And this we can look at salt intake and other various factors that take into place. We also wanted to see how family members are involved in the care of these patients. So they're always included, they're always encouraged to be included, especially to help with any kind of issues that patients may be facing. We want to make sure that not only the patients understand what's going on, but also their family members so that they can help. Especially when they set goals with their own providers. Sometimes the family members can be a tool for the patient to reach those goals. And most importantly, we want to make sure that any concerns of the patient are validated. They're never turned away, and they're never told that their issues or concerns are not important. So we want to make sure they feel validated and that the provider and the nurse can reiterate that information and demonstrate any kind of understanding for the patient. Also, we want to look at what cultural factors play into morbidities and the reasons why patients, do some of the things that they do. So, of course, patients do explain how they got a disease in a way that makes sense to it. For example, a lot of Hispanic patients will say that they got diabetes from a scare, in Spanish called a susto. And this, even though it might not be entirely accurate, we do see studies that show any kind of stressful events can create a rise in their blood sugar. So, for them it makes sense. For us, we can see some of that stress being a factor. Also, patients can mention that they use herbs to help with lowering glucose levels. They will also mention, for example, using alcohol for children to relieve any kind of fevers. They'll place alcohol on their bellies, or they also cover them up completely to be able to sweat out any of the sickness. Finally, another way that culture plays into their healthcare, patients do seek a massage person, a sobador, to help with any kind of muscle pains or even constipation. And also, we want to address language barriers that exist. So again, this is done at the beginning where the patients demonstrate which languages they speak. If any kind of interpreting is necessary, then that's taken care of. Also, cultural matters are addressed. I know we've talked about this in class and certain discussions, but for example, when female patients only feel comfortable talking to other female providers, we want to make sure that that is taken care of. Also, there's certain cultures that only prefer female providers, so we want to make sure that, when there's only a male provider, then we can have either someone there or also ask the patient, are you comfortable with this? And also finally, all employees of the organization do go through a cultural competency training, and it teaches them a lot about being aware, being open to other cultural norms and practices, and being able to not only address them, but accept them and help the patient and the provider effectively work on their communication. So now we'll move on to correlations between the course.
All right, so learned a lot about cultural competence in this course, and we thought we'd create some correlations between the course and what we observed and highlighted in our interviews. So as we know, cultural competence has the clear definition of a set of congruent behaviors, attitudes, structures, and policies that can come together to work effectively in intercultural situations. And we observed that based on the specific population that a organization serves, that's really important to take into consideration. So some considerations when providing that care to a certain population is to set and maintain a goal of providing health services in a culturally sensitive, knowledgeable, and non-judgmental manner. And to be able to also change one's own assumptions and really just ask the right questions, generally to avoid generalization and to avoid stereotyping based on background. Also integrate different approaches to care. Many cultures have their own sort of traditions and ways of treating, so being able to respect that, as well as provide care in accordance with medically sound practices that are, of course, legal and ethical, but while acknowledging the patient's cultural norms, so understanding what their traditions are. So we observed that the primary community or population that's served within our organization is the Latino population, about 74%. So some general demographics of the Latino population, they're the fastest growing population and group in the United States. It's actually been estimated that by 2050, 1 in 4 Americans will be Latino. And then currently about 15% of the population is primarily located in California and Texas. And Mexicans are the largest group of Latinos at about 66% in the United States. And a survey in 2004 also found that 22.5% of this population lived in poverty in a poverty level, which is compared to Caucasians at 8.2%. So it's definitely at a higher rate. And it's been also surveyed that 50% of households use some sort of welfare. And the Latino population is the highest population amongst any other population to be at this high rate of using welfare, which leads us to understand that they are the highest health uninsurance rates. So they're the highest number of people who don't have insurance. So, and while communicating with this population, it's really key when providing health services to this communication. As we saw in the interviews, things like language barriers, cultural beliefs, and social structures play a really important role in ensuring providers are carrying out culturally competent care. So some things to keep in mind that are common in that culture is to avoid straightforward conflict and criticism. That's not taken very well. They have a tendency to be close and touchy. They have little personal space, so that's okay. And avoiding eye contact would probably be best. Silence can usually mean that they don't really understand what they're being told, or they're not fully comprehending what the communication that's happening. Modesty and privacy are things that are very highly valued in this culture, and it's suggested that same-sex interpreters should be used whenever possible because of this modesty and privacy, and especially when it comes to sexual issues. So some health risk factors that we see in this population that is served. Things that influence it, such as social factors, could include low socioeconomic status, highest percentage of welfare used in this population, the subsequent lack of access to healthcare, the lifestyle, their choices, their environments, and their behaviors all contribute to disparity and health risk factors. Their typical diet consists of high fibers and low in leafy green vegetables and low in dairy products, as well as a really high carb intake, beans and rice. We heard some stuff in the interviews as well that went into more specifics about nutrition. They have high in tropical fruits and fruit juices and starchy roots. And common health problems that these factors are tied to are most commonly obesity. They have high rates of high body weight and obesity. Approximately 73% of males and 72% of females are overweight or obese in this community, as well as cancer. There's a high incidence of mortality rates for stomach and liver cancer compared to white people. And more particularly, Latino women are twice as more likely than white women to be diagnosed with cervical cancer. Diabetes is also really important because they're twice as likely as white adults to be diagnosed with diabetes based on social factors and their diet. There's also a prevalence of HIV/AIDS. Latino males have triple the HIV rate as white people and 2.2 times as likely to die from AIDS, as well as Latino females have HIV rates more than 5 times that of white females and 4 times as likely to die of AIDS. So we also saw that our organization also serves African American and Middle Eastern populations. So there's a little bit of information about them as well, as correlated with our course. Some social factors are that African Americans live in high poverty and they also have low access to care, as well as they have a cultural tendency to rely on family and a large reliance on faith. So that's really important to them and important to consider when providing healthcare, as well as Arab Americans. There is some overlap with reliance on family. It's very patriarchal, and modesty is very important. But the difference here is they relatively, compared to other communities, have a higher income, and they're also surveyed at 80% of this population has health insurance. So African American diet is usually high in fat and sugar and sodium and fried foods, and they also have a low consumption of fiber and vegetables and fruits. Arab Americans have been described to have a generally healthy diet per se, but a lot of desserts that they eat have a lot of high butter and sugar use. They also have a lot of high sodium. Some other tendencies within diet and nutrition and lifestyle includes drug and alcohol abuse, smoking, and which can lead to obesity, of course, and limited physical activity also contributes to this. And some common health problems included in both of these communities served are, like we said, obesity, diabetes, infant mortality, heart disease, HIV/AIDS, cancer, amongst African Americans, as well as Arab Americans. Most generally suffer from cardiovascular disease, diabetes, cancer, and some incidents of mental illness. And then just to kind of bring things together, wrap things up. So our organization consists of 14 health centers that service 70,000 uninsured and medically underserved patients. They get medical, dental, behavioral health care every year within the San Fernando and Santa Clarita Valleys. And the majority of patients served is 74% Hispanic Latino. And also in efforts to deliver culturally competent care, the center has done a really great job of identifying and assessing and serving the needs of their population based on their demographics and their lifestyle and social values, as well as their communication styles and health risk factors. Yeah.